Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. I don't have to tell you that osteoarthritis is a disabling degenerative joint disorder that involves chronic inflammation, joint pain, decreased mobility, and often has a negative impact on the person's quality of life. Osteoarthritis of the knee is the most common form of arthritis and has a very high prevalence rate compared with other types of osteoarthritis. A lot of people develop osteoarthritis of the knee as they get older. And the use of non-steroidal anti-inflammatory drugs like aspirin and ibuprofen, indomethacin and Voltaren and so on, and or acetaminophen are often prescribed to reduce inflammation and pain, but many people don't respond well to these medications, especially if they're used over a long period of time. As well, non-steroidal anti-inflammatory drugs are known to cause intestinal erosion and irritation, as well as intestinal ulceration, intestinal bleeding, and they can produce a decline in kidney function and also increase cardiovascular disease risk by raising blood pressure and or producing or triggering congestive heart failure. And acetaminophen is the leading cause of drug-induced liver failure in this part of the world. So the published study in the journal Phytotherapy Research in March of 2019 should be of great interest to people with osteoarthritic problems, especially if they have knee arthritis. These researchers used the extract of Boswellia serrata, that's a plant, the Boswellia plant, an extract from that plant to treat 24 patients with mild to moderate knee osteoarthritis for a period of 120 days or 4 months. Well, the 24 members of the placebo group who also had arthritis were given a placebo pill for the same period of time. So this was a double-blind, placebo-controlled clinical trial, meaning that neither the doctor nor the patient knew if they were getting the Boswellia or the placebo pill. This was also the longest study to date, 120 days of treatment, where the researchers tested a Boswellia supplement to treat knee osteoarthritis. The results showed that Boswellia supplementation significantly improved the physical function of the patients by reducing pain and stiffness compared to the group given the placebo. And X-ray studies also showed improved knee joint gap space and reduced osteophytes, or reduced knee spurring, confirming the efficacy of Boswellia in the supplement group, sort of these objective measurements that really tell the story. Boswellia supplementation also significantly reduced blood levels of a very important marker for inflammation known as the C-reactive protein. And none of the patients that took the Boswellia supplement for that period of time reported any adverse side effects. Now, previous studies have shown that Boswellia supplementation can be helpful in knee osteoarthritis, but this was the largest study ever undertaken to date and had a longer duration, and the research methodology was superior to previous studies. So how does Boswellia help with arthritis? Well, experimental studies tell us that certain constituents in Boswellia, specifically boswellic acids, produce anti-inflammatory effects via several important mechanisms that are actually similar to the effects of some anti-inflammatory drugs, but without causing the adverse side effects like intestinal irritation, bleeding, decline in kidney function, raising of blood pressure, not triggering congestive heart failure. You don't get those side effects with Boswellia. But if you choose to use Boswellia to treat arthritic problems, it's important to use a product that contains a standardized grade of boswellic acids. It should say Boswellia serrata 70% boswellic acid standardized grade, boswellic acid standardized grade, to ensure it'll provide the desirable effect. Some companies just grind Boswellia up, put it into a capsule and sell it. But it needs to be a standardized grade yielding at least 70% boswellic acids. It should say that on the ingredients panel. Now, for patients with osteoarthritis, I personally like a supplement that combines turmeric or curcumin with Boswellia, with white willow bark extract, and ginger combined into a single capsule. These four natural anti-inflammatory agents work synergistically to help reduce inflammation and pain in various arthritic conditions, and they don't produce the side effects associated with non-steroidal anti-inflammatory drugs or acetaminophen. So the 2019 study in phytotherapy research has strengthened our appreciation for the degree to which Boswellia supplementation can be helpful in treating knee osteoarthritis, which is an important consideration for many adults who suffer from this problem. So I've included the reference for this research in the text below. Thanks for watching, and I'll see you next time.